my head-to-toe health assessment. As I walk into the patient's room, I'm going to go ahead and perform hand hygiene. Introduce myself. Hi, my name is Lauren. I'm going to be your nurse today. Can you state your name and date of birth, please?
Lauren Scancio, 4/22/1960.
Good. And do you know what month and year is today?
Today is 6/30/2019.
Okay. And what brings you here? What's the reason for your visit?
Just a regular physical checkup.
Okay. Do you have any allergies?
No.
Any pre-existing health conditions?
No.
Are you taking any medications?
No.
Okay. Do you drink alcohol?
Once in a while.
Socially? Okay. Are you taking any street drugs, illicit drug use?
No.
Okay. Do you smoke cigarettes?
Yes.
Okay. How many packs a day?
No, just 5 to 7 sticks.
5 to
a day.
7 sticks a day. Okay. Do you have any family history?
Yes, I did.
Okay. What was it?
My mom was diabetic.
Okay, she's diabetic.
Mm-hmm.
Was that insulin dependent?
No.
Okay. I'm gonna go ahead and start off with your vital signs.
Mm-hmm.
Just off of your voice, your response to me, I can tell that the patient is awake, alert, oriented ×4 to person, place, and situation. So with vital signs, I'm gonna go ahead and check your blood pressure. (102/64). Is your blood pressure usually down on the lower end?
Yes.
Okay. And now I'm going to check your heart rate. Now checking her radial pulse, I'm going to go ahead and count using my watch for 30 seconds and multiply that by 2, as well as check her respirations. Your respirations were 16 and your heart rate was 84. I do want to ask, are you running any fever, any temperature lately? No? Okay. So I'm going to go ahead and just with your response, the way your articulation, we were already checking for cranial nerves 5, 7, 10, and 2. Okay? So now I'm going to go ahead and assess her skin. Just check for any lesions, any bumps, any bruising. Check for the skin. Okay. I'm going to check your capillary refill. Usually capillary refill should be pink and return less than 2 seconds. Okay. I am going to assess her skin for skin turgor. No tenting. Okay. Her skin color is appropriate to ethnicity. There's no tenting. Her skin is smooth, dry, and firm. All right. Next, I'm going to go ahead to assess your head. I'm going to go ahead and palpate, feel for any lumps, bumps, tenderness, any pain while I'm palpating. Do you feel any tenderness?
No.
Okay. So I'm looking, there's no scaling, there's even hair distribution. Okay. No lesions, no bumps, no evidence of trauma. Okay. And let me take a look at your face. Face is symmetric. I'm checking for cranial nerve 7, so looking at your eyes are symmetric. And I'm going to go ahead and use my follow my pen light. Well, actually, I'm going to have you take a look behind my shoulders. I just want to take a look at the responses, your corneal light reflex responses. Good. And now with your eyes only, go ahead and follow my pen light with just your eyes. So I'm using the H-test. Go ahead, follow just with your eyes. I'm using the pen light, and that was checking for PERLA, which is pupils equal, round, and reactive to light with accommodation. Okay, so your corneal light reflex were symmetric, and usually with the otoscope, I'm going to go ahead and assess the internal structures of her eyes if we had the instrument to check the the intraocular muscles which are intact. Conjunctiva, I'm just going to lower the area. No redness. Eyelids are non-puffy. Okay, the sclera is intact. Cornea and irises are intact as well. So now I'm going to go ahead and move on to your ears. I'm just going to pull back the auricle pinna. Using my pen light, I'm going to take a look. The tympanic membrane is intact. It's pearly gray. Any pressure when I apply, any tenderness or pain when I'm applying pressure to the tragus?
No.
Good. I'm going to go ahead on this side. Tympanic membrane is pearly gray on the right side as well. Any ringing? Do you have any vertigo or any ringing in the ears?
No.
Okay. And you're not using any hearing aids, correct?
No.
Okay. So now we're going on to assess the nose. We're going to assess for patency. Go ahead and breathe in. Exhale. Okay. Go ahead and breathe in. Good. Now I'm going to check the inside of your nostrils. I'm checking for your nares. I'm checking the turbinates. No discharge. No history of nosebleeds.
No.
Okay, good. And the nasal mucosa looks moist and pink. Okay. Now we're going to go ahead and check your lymph nodes. I'm going to start off with your frontal sinuses. Just tell me if you're having any pain when I apply pressure. Any pain?
No.
Okay. I'm going to take a look at your maxillary sinuses. Any pain?
No.
Periorbital edema. And then no discomfort at all, right?
No.
So now I'm checking your temporal mandibular joint, your jaw. Okay. And your occipital lymph nodes for any uneven distribution, any nodes, knots. Okay. Your post-auricular lymph nodes. Your pre-auricular lymph nodes. Okay. And then we'll check your parotids. Go ahead, bite down for me. Bite down for me, thank you. I'm going to go check your retropharyngeal lymph nodes. Submandibular. And your submental. Good. While I'm up here, I'm going to go ahead and check your anterior cervical chain for any swelling or any uneven distribution. All right. And then your anterior supraclavicular chain. Good. No tenderness or pain while I'm palpating there.
No.
Right? Okay. So let's go ahead and move on to the lips, to the mouth. Your lips are moist and pink. I'm going to go ahead and take a look at the inside of your mouth, okay? How often do you brush your teeth?
3 to 4
Okay.
times a day.
Let me take a look at your teeth. Go ahead and smile for me. Thank you. Let me take a look at your gums. No redness. Gums are intact. No lesions, no sores, correct?
No.
Can I take a look at your tongue? Okay. And I want you to look, sway left and right with your tongue. Left and right. Good. Okay, up and down. I want to see the roof of your tongue. Good. And then last, I'm going to check with a tongue depressor. I want to take a look at your gag reflex. We're checking for cranial nerve 8 and 9. Go ahead and say ah. Ah. Good. And then go ahead and say ah again. I want to check your uvula. Good. Uvula looks midline. So now I'm going to go ahead and have you close your eyes. I just want to make sure that you're able to feel sensation. We're checking for cranial nerve 7. Let me know if you feel a cotton ball, if you feel soft or sharp. Okay, go ahead and close your eyes.
Soft. Hard. Soft. Soft. Hard.
Good. Thank you. So that was checking for cranial nerve 7. All right, go ahead and raise your eyebrows for me. Good. Smile. Puff out your cheeks. Good. Thank you. And now we're moving down to the neck. I'm going to go ahead and take a look at your carotid pulse. Okay. All right. I'm going to take a look at your trachea. Make sure that the trachea is midline. Okay. It is midline. Okay. So I am going to have you take a sip of water, keep the water in your mouth, and then swallow when I tell you to, okay? I'm just gonna go right behind you. Just checking for midline. And swallow. Good. Thank you. There's that. Okay. Now for cranial nerve 2, I'm gonna go ahead and have you shrug your shoulder against my hand. Go ahead, shrug up. Thank you. Doing good. Okay, now while I'm having you shrug your shoulder, I'm also checking for the trapezius and the sternocleidomastoid muscle right here. Okay, so go ahead, can you go ahead and look down for me? I want to check the motion, range of motion on your neck. So go ahead and look down as far down, and go ahead and hyperextend. Look up to the ceiling as far back as you can. Okay, thank you. We're checking for flexion and hyperextension of your neck. So now we are going to go ahead and check for the external jugular vein for any distension, which I do not see any, nor do I palpate or feel any distension. Okay, good. Now for the chest, I want to make sure I'm assessing your chest, your lung fields, making sure that your inhalation is without any distress. I'm checking to see if you're having any use of accessory muscles. You feeling any short of breath? Any difficulty breathing?
No.
Okay, good. Now I'm going to go ahead and percuss. I'm going to check for tactile affirmatus. Okay, good. And making sure that I am assessing the chest for any lumps, any tenderness, no tenderness?
No.
Okay, good. I am going to use a stethoscope and start listening to your chest sound, to your breath sounds, anterior and posterior. Okay? Go ahead and breathe normal for me. Take a look at the back. And breathe in. Exhale. Breathe in. Exhale. Now relax. Okay. So while I'm back here, I'm actually going to observe respirations using the 99 test, okay? I'm going to have you say 99 as I'm feeling for any resonance, any vibrations in your back. So go ahead and say 99.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Good. And then I'm also going to check for CVA tenderness, costovertebral angle tenderness, right around here. Take a look. Any tenderness?
No.
No pain, no discomfort?
No.
Okay. So I'm going to go ahead and do percussion too to see if there's any difference in sound. Okay. No tenderness, correct?
No.
All right, good. Now we're going to go ahead and move on to the heart. I'm going to go ahead and listen to your heart sounds. starting with the pulmonic, second intercostal space. Correction, this is the aortic. And then on to the left, second intercostal space is going to be your pulmonic. Now, Erb's point would be where I would hear S1, S2, the lub-dub of your heart. And tricuspid valve. And lastly, the mitral valve, which is the fifth intercostal space, mid-clavicular. Okay, your apical heart rate is regular. Good. Now I'm going to have you lay down for me. We are going to go still with cardiac. We're still going to take a look at the rest of your pulses. I've already checked your radial pulse. And so I'm going to go ahead and assess your brachial pulse. Oh, let me go ahead and go this way. All right. I'm going to do it to both sides. So let's go ahead and listen and feel for your brachial pulse. Yep. Okay. I'm going to go ahead and assess your femoral pulse by your groin. 2+. Okay. I'm going to go ahead and assess behind the knees at the popliteal pulse. Okay. All 2+, good. And lastly, your dorsalis pedis. I'm going to go check. Good. All peripheral pulses are at 2+, okay? So while I'm here, I'm going to go ahead and check your abdomen. Well, I'm probably going to need this. As you're laying down, I'm assessing your abdomen. Just go ahead and lay your arms right here. I'm going to assess your abdomen, check for contouring, any deformities, any distensions. Make sure that the umbilicus is midline. Good. No, make sure that there's no bulging. Just keep this here, okay? Make sure that there's no bulging, and listen to your bowel sounds. So listening to your bowel sounds, I usually will hear a gurgle within 5 seconds to 4 quadrants of the abdomen, okay? Good. So far there's no pulsations, no bulging. The bowel sounds are normal active. I wanted to check for bruits to the renal arteries, so I'm going to go ahead and do that to the upper right quadrant, a little slightly above the umbilicus. Check for bruits or thrills. Okay. Now we're going to do, I'm going to remove this. Now we're going to do light palpation. Just tell me if you're feeling any tenderness or discomfort, okay? Any tenderness here?
No.
Okay, that was light touch. Now I'm going to go a little deeper. I'm going to try to feel for your organs. Let me know if there's any discomfort, any tenderness. Usually the liver is not palpable, but you can be able to detect the edges of the liver. Any tenderness? Any pain?
No.
Good. The spleen is ideally not palpable as well, but if there's any distension, you would be able to assess it and palpate it around this area. Good. Okay. So now that we've assessed that, I'm going to go ahead and assess the liver span. So what I'm doing is percussing the sound, the difference in sound. I'm just going to go ahead and reach over you, I'm sorry. We are just assessing the liver span, okay? Let me just get the other tape. Now with the two markings that I've had, I'm gonna go ahead and measure. Your liver. Your liver is at 6.5 centimeters. So that sounds about right. Okay, good. All right. So now that we've checked the liver scan, I'm gonna check for abdominal reflex, okay? So same thing that we did earlier, we're gonna go ahead and have sharp and dull sounds. Let me know, close your eyes, let me know if you feel anything, if you feel.
Yes. Yes.
Good. Alright. So we've checked for enlarged spleen. Now we're going to check for coordination. If you don't mind standing back up, or sitting back up rather. Nice and slow. Okay. We're going to go ahead and check for coordination. So I'm going to have you with your point your finger on both sides. I want you to go ahead and point to your nose and do it as fast as you can, alternating. Good. All right. And while you're sitting, I want your hands to be out like this and flip it up and down as fast as you can. All right, good. And now we're going to go ahead and assess for deep tendon reflexes. So I want you to place your bum right here. I want your feet a little off the floor. We're going to go ahead and start with biceps. Okay, so this is going to be. Good. I'm going to go ahead and have you relax your arms right here. Okay. Same thing on this side. Relax. Good. Now we're going to check the patellar reflex. Go ahead and. Good. Okay. And usually for the Achilles, we're going to assess right behind the ankle to see if you have any reflex, okay? Thank you. All right. Now while we're down here, I'm going to check your legs for muscle mass, hair distribution, which I don't think you have any hair down here. For venous pattern, any varicose veins? No lesions. Your skin is warm to touch. Smooth, it's firm. Okay, no abrasions or anything, okay? I'm also going to check your toes for clubbing. No clubbing. Good. And we're going to check, we've done capillary refills to your hands, but we're going to check them on all your toes as well. Less than 2, and your capillary refill is pink. Okay, and for right here, I want you to try to see I want to see dorsiflexion and plantar flexion. So go ahead and point your feet up. Go ahead and push back up as much as you can. Thank you. And go ahead and flex your toes and push against my hands. Thank you. Okay, good. Now there is one thing that's going to be a shin against your opposite, it's going to be the heel of your toe, the heel of your feet. Yeah, there you go, perfect. And go ahead on the other side. Good, thank you. All right, now we're going to go ahead and check spine for scoliosis, okay? I'm going to have you stand up. Okay, with checking your spine, I'm just going to see that your spine is midline. Go ahead and just keep straight. No, keep straight. I just want to take a look at your spine. Checking that it's straight in the line. And then are you feeling any pain, any tenderness?
No.
As I'm palpating. Good. Okay. So now while we're here, I want you to go ahead and reach for your toes. I want to see your flexion. Good. And now while you're there, I want you to hyperextend and lean far back as much as you can. Awesome. Thank you. And have you do the shallow knee bend. So with one foot, go ahead and try to bend your knee. Good, and do the same thing in the other side. Check for balance. Good. All right. Now we're gonna check your gait. We're gonna make sure that you have a steady gait. So from here, I want you to go ahead and walk towards me from your heel to your toe in a straight line. So go ahead, straight line. Excellent. Now when you turn around, I want you to go ahead and work on your tippy toes in a straight line. Good? Good. And now lastly, I want you to go ahead and do that one more time, but on your heels. Excellent. All right. We are going to keep you standing. I want you to keep your feet close together, your feet together. Go ahead and do your feet together. And your hands apart. And I want you to close your eyes. I want to check for any swing. So go ahead and close your eyes. Good. And that was the Romberg test to see if you're having any swing. Okay?
Okay.
All right. Lastly, you pretty much did everything and we've pretty much completed the full exam. I just want to make sure, do you do self-breast checks at home?
Once in a while. If
Not
I
too often?
remember.
Okay.
No.
So try to get into the motion of self-checking your breasts at least once a month. The best time to do it is in the shower. When everything is warm and relaxed, you're going to go ahead and palpate or feel both breasts at a time. Make sure you're feeling for any lumps, any bumps, any tenderness, anything abnormal, any nodules. You can also check and assess for anything underneath the armpits as well, the axilla. Okay?
Okay.
Do you have any questions?
No, that pretty much answers all my concerns regarding my health.
Okay, sounds good. Thank you.